Are you suffering from the symptoms of neuropathy? Have you been given drugs to kill the pain or for the other symptoms? We have an all-natural treatment program which consists of structural realignment, meal planning, and technology to restore the health to the damaged nerves and the damaged blood vessels that are causing this condition. Call now for an appointment. It will include an explanation of your problem, if we can help you, how long it will take, and how much it will cost. Take advantage of our very special offer, which is $25 to find out.
Well, with us now is Dr. David Manago, and he has brought along a patient, Linda Rohr. I'd like to welcome both of you.
Thank you.
Nice to meet you. Nice to see you again. And the basic topic we're going to talk about today is neuropathy, right?
Correct.
And we've got some slides that we're going to show. And right away, we can see exactly what neuropathy means, right? It's a disease of the nerves, right?
Correct. A lot of people get confused by the term, but neuro simply means nerves and pathos means disease. So a person literally has diseased nerves, and they suffer from a myriad of symptoms. Like this picture shows the tacks in the foot.
Right.
And that's one of the classic symptoms people feel.
You feel, and this is what you had, Linda?
Exactly.
And do you actually feel...
Stabbing,
okay,
excruciating pain. It was awful.
So it's more than just, you know, we all go through what we call, you know, our foot fell asleep. You know, you get that for about 5 minutes, you get that tingling and kind of feeling. So it's like that to the 100th degree, then,
yes,
right?
Exactly.
Okay.
Yeah.
And let me ask you, does it come and go when you have this, or does it just last a few minutes?
Initially, when I first had it, it lasted like almost 3 months. I could not get out of. I couldn't stand on my foot. I could not put it on the floor.
Wow.
It was just
so that's
pain.
you know, symbolized here by the different things that people may feel.
Yes, and hot.
Exactly.
So hot. Oh, it's bad.
Wow.
Yeah.
Now let me ask you: could you visually see anything on your feet? In other words, is there redness
it would
or anything
swell.
like that?
No,
Okay.
it would swell, but it was all inside.
Wow. And you know, we hear about this. Does it usually just affect extremities, feet? Does it ever affect one's hands or other parts of the body?
Oh, sure. People get it in their hands and in their face as well. But the feet seem to be the most debilitating because, of course, the person can't walk.
Right.
Like in Linda's case, if I could speak for you, she came in with a boot on her foot because she couldn't touch anything with her foot, and nothing else could touch her foot, or it was excruciating pain. So the doctors just covered it up with a boot to keep her out of pain.
Right.
And it was awful for her. I mean, she'll tell the rest of her story as much as we can cover in this time, but she was a very classic case of a terrible neuropathy case.
And what brought this on, in both your opinion?
I have no idea.
Okay.
It was like 1:30, and I remember 1:37 in the morning. Boom! That just stabbing, like somebody was stabbing me with a hot knife. It was just
And
unbearable.
here we see a picture of what's going on. How does this come on that sudden, like as she said, or was it maybe there and not as bad, and then it just flares up?
It depends on the patient, because each patient has a different tolerance to pain.
Okay.
Just like anything else, not everybody hurts to the same degree with the same problem. But it is a actual slow deterioration, as you can see on the picture, of the blood vessels that actually feed oxygen and nutrients to the nerve. So the nerve gradually becomes malnourished.
Okay.
And that's where the disease comes in. Like the nerve isn't getting enough oxygen, it can't send the signals from one section of the nerve to the next, and then whatever body part that nerve goes to begins to hurt, go numb, tingle. It can feel like it started overnight, but this is a very gradual but degenerative condition. So what happens all of a sudden is the patient can finally feel it. The degenerative process is going on way before the patient ever knows it.
All right. So, of course, what everyone would probably want to know is what are perhaps some of the causes, and or is there something that one can do to prevent it from beginning in the first place?
Well, typically it's a lack of oxygen from the blood to the
Okay.
nerve. There's many, many, many causes of that, like
Okay.
diabetics, for
course,
example.
yes.
There's a large part of our world that have neuropathy. There's 20 million people in America, but the causes are way too many to mention. But in the line of what people generally know about it, toxicity,
Okay.
you know, drugs over the counter or otherwise, Agent Orange. Obviously, we mentioned diabetic already.
Right.
There's actually too many causes to mention,
Okay.
and many of them can be happening at the same time.
Mm-hmm.
So you can't isolate one cause and say this is the cause of your neuropathy, because most people have many, many things going on at the same time.
Okay, so therefore, it may be something that you do not have the ability to prevent because you may be reacting to something that happened to you years ago,
Yes,
right?
that's what my doctor told me.
Yeah, but you don't know the exact
I don't
underlying
know,
cause
no.
of it. Yeah.
No,
Which can be frustrating for people. You
Oh,
know,
my
most
goodness.
people, I think, whenever you get any disease, it's like, okay, why? What did I do to cause this, or what happened to me to cause this?
Yeah.
And most of the time, you're right. You're right. It's like, well, there's many causes.
Yeah, as well as, you know, going forward, a person can't change whatever they did. So, in going forward, getting rid of a condition, like it doesn't matter what Linda did at 40 years old or someone else did at 30 years old. It matters only what they do now.
Right.
And the key thing is that people really need to be proactive because it is a serious, dangerous condition.
Okay, as far as treatment goes, we see this device on the screen, this slimline system. Is this what you start with, or are there other treatments that you begin with if it's more of a mild neuropathy? How do you go about it?
Well, the object is to rehabilitate the blood flow.
Okay.
So the nerves get the nutrition they need to be well. So this particular treatment is done with LED lights.
Okay.
And the lights actually open up the flow of blood because they energize the body at the cellular level. There's photosensors, which are sensors to light in every cell. And when you stimulate them with light, they produce 10 times as much energy as they did before without the stimulation. So this is one part of the treatment that actually energizes every cell and gets the blood flowing.
Okay.
Then there's a nutritional component, because toxicity is a huge factor. So we do a little bit of detox and prescribe the proper nutrition. Then there's creams that are known to open up the circulation underneath the skin. And there's also a whole body vibration unit that shakes and bakes your body. It actually wakes up the flow of blood and the lymphatic system to get everything flowing so that the blood is flowing through the nerves.
And Linda, have you done all of these type of treatments?
Yes.
Okay, and tell me about the effect for you and how long you've been doing the treatment.
I started in, I think, December.
Okay, something like that.
Maybe November. But it helped me. I mean, I can't tell you the difference. I actually told my doctor, if you can't fix this, cut my foot off.
Wow.
Yes.
Now, how often do you need to do the treatment, or is it something you can do at home? Do you come into the office?
Well, initially, I went 5 days a week. I think for a month.
For the neuropathy, you came 3 times a week.
3 times,
Okay.
three times a week. But I'm telling you, the difference is amazing.
And how, as far as once you start that treatment 3 days a week, does that continue for a certain length of time, and does it go to once a week? How does that work?
It depends a bit on the patient.
Okay.
But in a severe case, most people come in 3 times a week for about 10 weeks. And the schedules can be variable a little bit. But then that's just the relief phase. Now, Linda, I would say, is probably 80% better. She couldn't walk. Then she walked without the boot because she got sick of the boot. She came in with a walker. Then she had a crutch, and she finally got tired of everything and felt fine, and then she drives herself wherever she wants to go now.
Yeah.
Because I
But
couldn't drive anywhere.
She couldn't drive, and they wanted to cut off her foot.
Right.
So now she's on a home care system. So she only comes to see us once a month, and she's very proactive doing the home therapy on her own. So she's not locked into our practice per se. As long as she's being proactive at home, the actual healing process will actually finish the job, and she'll reach a maximum level of improvement that she can maintain for the rest of her life.
And as far as where you had the neuropathy, was it only on one foot, both feet, other extremities?
No, mostly my right foot,
Okay.
but occasionally on my left foot also.
Okay.
And I don't know why that is. I mean, so much worse on my right foot.
Interesting. Is there
Yeah.
maybe a reason somebody favors their right foot the way they walk, or it's just that's how it manifests?
It's a little bit unpredictable.
Okay.
Sometimes, as a chiropractor, I find nerves that are actually pinched in the lower back that go to the feet. And since I'm not a traditional chiropractor, I don't do any traditional manipulation. I see a lot of seniors, and so we have to detect if the nerves are being pinched in the lower back and actually correct that.
Okay.
But that treatment's done with 6 ounces of pressure, so there's no popping and cracking, so it's very safe for the senior community to come and see us.
Okay. Very good. Well,
Right.
I'm glad it certainly has helped you.
Oh, it certainly has. I can't
That's
tell
fantastic.
you the difference.
Yeah.
It's been amazing.
And will her therapy go on indefinitely, or is there a point in time where you can say, okay, you're good to go here? Or is that just...
The point is that you'll probably never completely regenerate everything, so you're brand new.
Okay.
So it's just like your teeth. You have to clean them every 6 months.
You're right.
You have to change the oil in your car.
Okay.
So she will need, like everybody needs, some kind of physical maintenance. But she can do most of that on her own, which
Great.
is the beauty of it. And I mean, I think the key thing for people to know is that this is a degenerative condition. If a person doesn't make a choice today to get going on correcting the problem, it's going to get worse.
Okay.
And the worsening cases actually have to have their foot cut off or their toes cut off or something drastic, just like a
Right.
diabetic patient.
Yeah.
So why wouldn't somebody get checked out and find out if they can be corrected?
Exactly. Thank you for coming on. Nice to
thank
meet
you.
you, Linda.
Thank
and
you.
Doctor, nice to see you again. And the number you can call for Dr. Manago's office is 949-364-5656. Good to see you both. And we'll be
That's it.
right back.
Thank you very much, Ken.
Nice to see you.
Thank you.
Dr. Manago's method helped my body heal itself. And it was simple, it was comfortable. I already feel so much better. I'm fixed. It's worth the time commitment. Absolutely, your body is worth it. And this is real healing. So you're just gonna get a new foundation for a pain-free life.
Why would you wait until your symptoms get worse before finding out if we can help you? Take advantage of our very special offer, which is $25 to find out. Call now.